Hello friends, let's today talk about best treatment for AVN hip. So let's first start with what is AVN. AVN is avascular necrosis. In simple sense, AVN means death of the bone tissue due to lack of blood supply. When the blood supply to the femur head is not normal, slowly a period of time, it goes into collapse and arthritis. Femur head is basically the ball part of the femur bone that forms the one half of the hip joint. Our hip is basically a ball and socket joint. So the socket is formed by the structure known as acetabulum and the ball is formed by a head of femur. So when this head of femur undergoes avascular necrosis, it actually breaks down, it collapses, and that leads to arthritis of the hip joint, which causes pain and discomfort to the patient. So when we talk about best treatment for AVN, first of all, we need to understand what causes AVN. So AVN can be caused due to long-term steroid use or excessive alcohol intake or some old hip injury or fracture, or sometimes blood disorders like sickle cell disease can cause it, or some autoimmune disease or metabolic disease, or sometimes there is no cause. So when we talk about best treatment for AVN, there are few modifiable factors and there are few non-modifiable factors. Non-modifiable factors include things like sickle cell disease or autoimmune disease, where you don't have any control over the disease. But in modifiable risk factors, we have something known as alcohol or steroid use. So if you can avoid alcohol or steroid, then definitely you can make sure that your hip survives. So from your side, you should not have alcohol, you should not use steroids, and of course you should avoid cigarette smoking because that also reduces the blood supply. Now coming to treatment of AVN, there are 4 stages of AVN. Stage 1 is only when the MRI can pick it up and the bone is still healthy in shape and outline. Second is when even X-ray can pick it up, some amount of changes they start happening. Stage 3 is when the bone starts to collapse. This is where the pain starts, the stiffness starts, and the patient gets real discomfort in doing daily activities. Stage 4 is when there is a complete joint damage or hip arthritis. So when we talk about best treatment for AVN, it starts at your home. You should avoid cigarette, you should avoid alcohol, and you should avoid taking any form of steroid. Now, when patient is in stage 1 or stage 2, we try to save the hip joint. So we go for options like we give medicines to increase the blood flow. We ask the patient to reduce weight. We ask the patient to do regular physiotherapy and hip exercises. Also, along with that, sometimes we offer patient surgery in the form of core decompression surgery, in which we make a small hole through the neck part of the femur bone with the hope of increasing the vascularity of the ball part, that is the femur head part. Now, there are many modifications of core decompression surgery. Sometimes we put bone graft with it, sometimes we put stem cells, sometimes we go for PRP, sometimes we go for bone marrow. So these are all modifications of core decompression surgery with the hope to save the patient's hip so that the AVN does not progress any further. But sometimes, in spite of our best results, best efforts, the AVN as such goes on progressing, and it can go into stage 3 or stage 4 of AVN. So when we have stage 3 or stage 4 AVN, then conservative treatment may not be helpful because patient is having severe pain due to arthritis. This affects his walking, sitting, and even sleeping. Joint movement becomes very less. So in such cases, we go for hip replacement surgery. In hip replacement surgery, we change the ball as well as the socket part of the hip joint. This new joint moves without pain and the patient is able to get back to his normal life. Normally it is done through a minimally invasive method these days, through small cut. And with this, patient is able to get back to his normal life. In young patients, we prefer doing uncemented hip replacement so that results are better, and if future need for revision is there, it can be done more easily. In older age group, we can go for cemented component directly also. So if you are suffering from AVN hip, First of all, avoid smoking, avoid drinking alcohol, ask your doctor, stop your steroids if possible, and if at all you are able to do these things at your own end, then you should visit your doctor, who will advise you further line of treatment based on what stage your AVN is. Thank you.